So this screencast is just a short screencast just to help you around interpreting the marking criteria and thinking of different ways that you can help the marking criteria work for you and not the criteria force you into a certain way of working. So we're just going to go over a few things that we often hear and just go through what we're expecting you to do with the marking criteria and what we're not expecting you to do, and then just an example of one of the projects that I myself have been involved with within my team at STH about how we're using the marking criteria to structure for us. So, what is the marking criteria there for? So, you have a marking criteria there to help aid decision making around a mark. So, obviously, for all students, they have to pass placement to pass the course. For MSc, it's just a pass and fail. And for the BSc placements, they do actually get a mark, and that does go towards their final degree mark. So, it is important to the students about the mark that they get, and obviously they do have to pass it to end up becoming a qualified physiotherapist. But it's there to help decision make and um, have an idea of whereabouts on the marking criteria the students are. It's also helped to assist providing feedback because it's a really clear way of going, you are doing this, you are not doing this, therefore you sit in this category at this moment in time. These are the aspects that we need to work on. So it can just help give some really structured feedback. So that's why we have a marking criteria rather than just a number being plucked out of the sky as well, so that it's easy for yourselves and the students to see the things that they are doing well and not so well and whereabouts they sit on the marking criteria. And that then leads into assisting with setting goals and action plans. So if it's really obvious and really clear what the student is or isn't doing, then they can see what's in the next category up and what difference they might need to do to move on that marking criteria. So they're the main reasons about why we have a marking criteria, what it's there for. So what is the marking criteria not there for? So it is not there to dictate how you run your placements. So the marking criteria isn't the be all and end all of placements. Placements is all about gaining experience and transitioning into a qualified practitioner. So it should not dictate how you run your placement at all. And it shouldn't be a hoop that you have to jump through, either the students or the educator. And that's what we are trying to kind of reinforce on these educator updates, but also reinforce to our students. Yes, your mark is important. Yes, passing your placement is very, very important. But it's what learning has happened. How have you performed on placement? What are your strengths? What are the areas you need to work on? Irrelevant of your mark. It's about having things like that, and it is not there to take away from valuable learning experiences. So I've just touched on that as well. But if there's something that is really important on your placement and doesn't quite fit into something on the marking criteria, it doesn't mean that you shouldn't give your students that opportunity, because it is still important, and all learning experience is a really, really valuable. So it is not at all there to take away from things that you think are valuable learning experiences. So what we commonly get asked or told or hear is, why is it so vague? So, in particular, the MSc marking criteria, which has actually changed to become more in line with the BSc marking criteria, even though it is still just a pass and fail that the students do need. Um, they are vague because if you can imagine, we have students out on placement in private practice, at football clubs, at rugby clubs, right through to really acute critical care settings, and everything and anything in between that. So our placements are getting broader, just as the same as the physiotherapist role is getting broader, and we can't make the marking criteria completely match every single area and every single setting and every single skill that everyone has in every different setting, which is why it's so vague. It's there for you to interpret. It's not vague to make it difficult for you at all. It's there to help you, which is something that I know some people do struggle with. So I'm going to go through a little project that I was involved with as part of a bigger project around student provision within my team. We get a lot of people saying my area is really difficult to interpret on the marking criteria because of one reason or another, because of the skills we do, because of the specialty. And again, we completely understand that must be really difficult, but that's why it's so vague, so that you can interpret the marking criteria in the way that you want to, in the way that you feel the skills and the attributes are needed within your area. And then we also get quite a lot of feedback around, my placement's too complex, I can't allow independent management, so they can't get marks. Nowhere in the criteria does it say a student has to be completely independent with this, this, and this. Again, it's more vague to enable students, because in one area they might be running a ward, working nearly completely independently from the start of placement, whereas in other areas they may need supervision throughout the whole of it, because it's more complex in the fact that it's something that they don't come across, particularly within university life, or just the type of patients that get seen. It might not be necessarily deemed appropriate for the students to be seeing those patients completely independently. So you have to interpret that in your own way again. So are they independent in identifying the problem list? Are they independent in going to talk to an MDT member? Are they independent in their own learning? So there's lots and lots of different ways to interpret all this different terminology. So it's not there to kind of be really, really structured and set you really rigidly. It's there to be flexible and make it work for you. So this is an example of one of the projects I have been involved with. So this is within the surgery division at Sheffield Teaching Hospitals. So this was a whole group of us from the respiratory medicine, CF, surgery, critical care, and cardiothoracic teams. We've come together and we've been doing a big project around services provision around placements and our quality around placements as well. And part of that was around the marking criteria, because we ourselves found it a little bit difficult to interpret, and whether there was the parity across the teams, across different people, and knowing exactly what it was that we wanted to do. So this is an example from the first year marking criteria, which was called DPP. Now this is now changed to ACRDM, but the marking criteria is fairly similar, but just set out in a slightly different structure. But this is just an example. So what we did, we decided that a good mark would be around the 60% mark. So anything below that, we'd want to pull our students up. Anything they were meeting that already, would want to stretch them. So this is just the marking criteria as you would have seen it previously. So what we then did was we decided what specific skills we would need. So we broke down the marking criteria, and what it was you'd be able to select and implement basic examinations, and you are able to implement appropriate physiotherapy interventions and modify. So we split that into assessment and examination skills, and then we split that into the knowledge of the interventions and then the application of the interventions. And as you can see here, we identified that if they were able to achieve the majority of these, then they'd be getting a good mark. And if they were starting to become excellent, they'd reach all the way down to kind of all 6 aspects within the sections. So we, as a kind of respiratory cohort, decided the variety of interventions, or what specifically that they would be able to do in each of the aspects. And by doing that, we as a cohort knew exactly what we were looking for, whether it would be an A to E assessment, whether it would be more complex than that. So that gave us a really clear structure of what is it that we're doing and how we're doing that. And we did that for each learning outcome. So we did, I've just given 2 examples here of learning outcome 1 and learning outcome 3, and you can have a look through that. You can pause the screencast and have a look through all of the things that we did there. The additional thing that we did, because were quite a big department and we would have a number of students with us all at once, normally upwards of 6 to 8. So what we did, each educator that had a student at midway and at final, before they gave the mark to the student, would meet up for half an hour and discuss where the student was on the marking criteria, what behaviours, what skills they had demonstrated, and then they had a marking parity between each other, and that gave the educator a lot more confidence that they were giving a mark that the student deserved, and that there was parity across those markers. And that's similar to things that happen within the university around the moderation processes of examinations. So that is something that you could consider, or doing it differently. Again, each department will work in very different ways, and it's about finding ways that work for you. That is the way that worked really well for our staff, and it's finding the way that worked for you. Within the project as well, we did lots of group learning with different facilitators, and all that feedback fed into the marking criteria as well. So we had a whole range of source of information to help with our decision making with the overall mark. So again, doing a similar thing with the marking criteria. You can go into as much complexity or make it as simple as possible, and write a list of specific skills of this would be a pass, this would be a pass. If they did this, this would be excellent. And going through like that, and you can make it as simple as complex as you feel that it needs to be for your area, and as a cohort of educators within your team would like it to be. So feel free to pause and go back to have a read over all of those in some more detail. And just remember, you know your clinical area and the specialty the best. You are the person that works in there day in, day out. The academic advisor and the student is not. So you know what skills are the most important to your specialty. Obviously, within physiotherapy, we have the key skills of problem identification, clinical reasoning, action, creating goals, setting action plans. They are kind of our core skills that go across all aspects. But the specific skills and different things are going to be more of a priority in different areas, and you are going to know that the best. Not all aspects need to be face-to-face experiences. Just because you've not seen the student do something with a patient face-to-face, if they've discussed it through with you, if they've shown that in reflections, if they've presented a case study, they can show you in a whole number of different ways, and that can alleviate a lot of the pressure to have complete face-to-face experiences. It is absolutely not necessary. Learning can happen and be demonstrated in many different ways, and not just face-to-face. Again, that will completely depend on your area and what you know and what you understand about your area as to how those experiences can be demonstrated. And lastly, is making sure you use the marking criteria for your placement. So use it to help structure your placement. Don't make your placement fit the marking criteria. So don't go, I have to make my placement fit the marking criteria. Make the marking criteria fit your placement. You can adapt and evaluate and interpret the marking criteria in the way that you know works for your placement. I hope this all helps interpret the marking criteria. Do get in touch with us if you are still struggling or have any concerns about the marking criteria at all. Thank you.